Good morning, all. There's no research video today because I want to hear from you guys. I want you guys to tell me, is there anything that you are curious about with regards to red light and whether it can treat certain things or help with certain things? Because that's at the end of the day, that's what I'm trying to put out is things that might actually help people or might actually say, oh, okay, yeah, I've been suffering from that a lot. I'm going to give this a go. Because again, it doesn't involve any drugs, it doesn't involve any side effects. So there are only positive outcomes. There are only neutral or positive outcomes. There are no negative, it's neutral or positive. So maybe because we are all individuals, so the results that I talk about from various studies might not be the same results that you get. Now, that being said, you might get less, you might get the same, or you might get more. Because how we respond to light, how we respond to anything, illness, anything is purely individual. So if you talk about light specifically now, okay, so if I went out into the light and out into the sunlight, how my skin and how my body would respond would be different to someone, say a redhead with blue eyes or a redhead with green eyes, for example. Because how we are built and how we respond to certain things is very different. Even so much as so, with the virus now, there is a difference. I read a paper yesterday on there is a difference between blood types and how they respond to the virus. And so your genetics play a very large role in what could happen. Also, the amount of light that you get naturally, because if you are someone that gets a lot of natural daylight on a large portion of their skin, then you will be getting red and infrared light rays, and you will be absorbing that naturally anyway. It's still not as powerful as the red and infrared that you would get from the lamp. But obviously, if you are someone that is, exposing large parts of their body to the sun and you're getting that infrared rays, and so your body is absorbing a lot more, then perhaps the red light panel might not work as well for you. But if you are someone that covers up and doesn't expose themselves to the natural rays of sunlight, then the red light will give you and your cells and your mitochondria the photons that it needs in order to work more efficiently. But again, it comes down to individuals. How you respond to the red light will be purely individual. And so that's what I want to hear from you. If you have any questions and you're curious, just drop me a message, and I will respond. I'm honest. If the studies have been done on humans, if the studies have been done on rats or mice or dogs or horses, the only reason I said that is because I read one on horses recently. And like I said about the rat study, does that mean we just throw it out if it's done on rats? No, because the mechanisms with which it works are the same in humans. But again, it doesn't necessarily mean that you can transfer all those results. It just means that you could look into humans and you might expect to get similar results. Same with the dog study the other day. The dog study showed positive results from red light, but the dog's got a lot of thick fur to get through. So could you hypothesize that you haven't got a lot of red light you haven't got a lot of fur to get through. So could the results that the dog's got actually be amplified because you're getting more photons absorbed through the skin to where it can be metabolically active? I don't know. That's the thing. I don't know. But you could hypothesize. And that's what I tell people when they ask me questions, when they send me questions on Instagram, by email, etc., etc. That is what I tell people is, look, this has been studied in humans and has shown this, this, and this. This has been studied in animals and has shown this, this, and this. The other thing you asked me about, I can't find any research on it. But maybe the mechanisms through which it might work, but I couldn't guarantee it. So you are taking a chance on that one. But if 1, 2, and 3 have shown positive results, then 4 might just be a bonus. And that's what I want to hear from you is, can it help with this or can it help with this? And I will find those research studies and I will explain how it works and I will help in any way I can. But remember, you've got just over 3 hours before my St George's Day sale ends, because it ends at midday Oslo time. That's 10%, including items that are already on sale. So go and grab a bargain, get some red light upon you, because remember, there is no negative to it. It's not like a pharmacological pill or whatever that has certain side effects, or side effects may include. It doesn't have any of that. All right. So the worst case scenario is that you get neutral, i.e., nothing happens. But then best case scenario is that you get very, very good results, similar to some of the papers out there, or even better results, because they took the average of the people in the research study. So there were people above it and there were people below it. So there is a chance that you get superb results. And you are an individual, so the results will be specific to you. So, as I say, there's no code needed. It's just there'll be 10% automatically taken off your basket total, and that includes sale items. So head over to lighttherapy.no and check it out if you want to get some more red and infrared light in your life, which I highly recommend. Have a great day. Stay healthy.